But we are kicking things off this morning with a segment sponsored by Russo Facial Plastic Surgery. We've got Dr. Russo and Dr. Adams here talking about the difference between a liquid facelift and a true surgical facelift. Welcome to both of you.
Thank you very
Well,
much.
thanks for having
I'm
us,
glad
Nicole.
that you're here.
It's nice to see you again.
So I love seeing you guys. People who are not familiar with liquid facelift, how would you describe that? Because when I hear liquid facelift, I think of Botox. Is it the same thing or different?
It's pretty much the same thing, but it's involving not just Botox. Botox is a neurotoxin that helps relax wrinkles between your eyebrows and your crow's feet. The other things that we use with a liquid facelift is fillers. The old collagen was the first of the filler materials, and now we have some newer materials that we use, and there's one that's based out of hyaluronic acid that we use, which is a natural carbohydrate that we have in our skin that helps to plump the skin up. You have the calcium type products, and you have fillers that help to stimulate your body to make its own collagen. Okay. And those tend to fill up the cheeks. You can have Voluma, which helps to lift the cheeks. You see a picture here where she's had some injections in her cheekbones here.
Oh wow, yeah, what a difference.
Kind of lift that area. And Restylane and Juvederm help fill in the wrinkles around the mouth. So these are things that we can use to just plump the face up and give a more youthful appearance to the face.
So looking at these pictures, it's quite a positive impact and difference. If there's this option out there, why would anybody, Dr. Adams, choose to then undergo a surgery?
Right, that's a great question, and fillers are a great tool to really prolong the need for surgery, but you know, today, with aging process, it's not only a loss of volume, but also laxity in the skin. And so when patients come to us with more concerns with laxity, specifically in the neck,
yes,
that's when we tend to start going down a more surgical approach for our patients.
Okay, because there's nothing that you can really do about, like, see, I'm already getting it, y'all. It's my mom. Thanks, Mom. But it's like that
That's
loose.
not your mom.
Yeah, no. That's not my mom. That's not. But my mom, who lives in Ohio, has this, and I have it too. And so the question then becomes like, okay, there's nothing really, filler can't fix hanging extra skin around your neck.
That's correct.
Okay.
That's when we get to a point where you probably need to do some surgery to help to tighten up the loose skin and the loose muscles that you have in the neck. It's difficult. This type of a patient here, a filler is just not going to do the job.
I mean, literally, what a gorgeous, she looks 20 years younger.
Well, you know, the surgery that we do nowadays really can make a big difference in the right patient, and it's done very conservatively. It should look natural. It shouldn't look overdone.
What's the price difference between a liquid facelift and a true facelift?
Well, over time, a facelift can actually even be less expensive, but you know, fillers are less expensive typically to do. We only do 1 to 2 cc's on the average patient. Sometimes we'll do multiple cc's on a patient. You know, a lot of volume is necessary in some patients, so it can get a little more expensive. But typically, the cost of fillers are a little bit less expensive to start with. But over time, if you keep doing it, you know,
adds up.
Every few months, it definitely can.
Okay. Dr. Adams, what about the downtime? If we've got a woman out there or a man watching that says, you know, I would consider this, but I don't want to be out of work for months.
That's exactly right. Some people's sort of goals and abilities for downtime are different, and so the fillers and Botox type of products are really nice because a lot of our patients will go back to work after receiving these treatments in the office. But if you commit to surgery, we ask that you give us about 2 weeks before you feel more comfortable getting out, going back to work.
Okay, well that makes sense. What about being a candidate? I mean, how do you know if this is something like that you're really truly candidate for, and if you're going to see a big difference?
Well, I mean, the best way to do it is to have an actual consultation with a specialist, preferably a facial plastic surgeon. Dr. Adams and I just do facial plastic surgery, and we restrict our practice to that. It's really ideal to be face-to-face with somebody. Sometimes we'll do online consultations, but it's really best to be in the office and give us a chance to see a three-dimensional idea of what the patient needs.
Well, I think that's important to mention. You guys have been in business for how long?
Over 30 years.
Over 30 years, a long time.
Yeah.
And they only focus from basically here up, right?
Yeah.
So I love that.
Yeah, that's all we do, and that's all we concentrate on. So we really really are focused on that area of the face.
Yeah, because I don't want somebody operating on my face that's going to do my toes too. Like, I want a specialty doctor for that kind of stuff. Thank you guys so much for being here.
It's always great to see you.
Dr.
Nicole.
Thank you so
Russo,
much.
Dr. Adams, we appreciate it.
Thanks
Don't
for
go
having
far
us.
at home. We're in the Mazer Kitchen next with Dean Sausage. You're watching TOA this Thursday morning. We'll be right back.